in the next 5 minutes. We just dealing with some technical AI matters, but we will soon start. Thanks for your patience. Folks, I got the nod that we may start the meeting, but before I do that, as we normally do in this standing committee, I'm going to allow for a moment of silence so that we can reflect. The moment starts now. Thank you. Thank you very much. Members, colleagues, Minister, you and the department, our stakeholders, once again, our apologies for being 10 minutes late. It happens with technology from time to time, and this is what we were faced with. Once again, our sincere apologies regarding that. As it is a procedure for the records, we're going to introduce ourselves so that when we engage, we know exactly whom we're dealing with. I'll start with myself. I'm Memory Boyson, and I'm the chairperson for the Standing Committee for Health and Wellness. And I'm going to go to my left, and then when we're done in-house, I'll go to the members online, and then we will come back into the chambers again. Thank you, member.
Good morning, Chair, Minister, committee members, and all officials. I'm Leon van Wyk, a member of this committee.
Good morning, everybody. I am Benedicta van Minnen, a member of this committee.
Good morning, everybody. My name is Rachel Winvogel, and I'm a member of the Health and Wellness Committee.
Thank you, members. I'll now give an opportunity to the members who are joining us virtually.
Greetings to all. My name is Dwayne Jacobs, and I'm a member of this committee.
My name is Thomas Walters, and I'm a member of this committee.
Good morning, everybody. My name is Donita Stevens, and I'm a member of this committee. Thank you.
Thank you, members who have joined us virtually. Minister, I'll give over to you. Thank you, Minister.
I mean, there's no one.
It's working now.
Members online, can you hear us?
Yeah.
Loud and clear.
Oh, thank you. Thank you. I see other members of the department at the back. We'll start there and then we will come to our stakeholders as well. Thank you.
Morning, members. I'm Susan Smith. I work in the Minister's office.
Morning, members. Raphael Friedman. I work in the Minister's office.
Thank you very much. And once again, a special welcome to our stakeholders. This is one of those fortunate committees where the attendance of our stakeholders are always critical, and it's always in numbers. I'll start with a lady who's very popular, and it's a name. I'll start with the lady. Can I try again? Let me see.
Oh, not ready. Did I click this one?
Testing, testing,
Oh.
testing.
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 All right.
Oh.
I was still saying then we have now reached the stage where we're going to allow our stakeholders to introduce themselves. And I was about to say that I'm going to start with the lady who has encouraged me to read the Bible. There was a time when she introduced herself and she used the verse Act 17, verse 34, if I'm not mistaken. And I went back home to double check. And indeed, I found the name and I read the rest of the chapter. Ma'am, over to you.
Damaris Kiewicz, Community Liaison Officer at the University of the Western Cape.
Graham Lindors, Chairperson of the Tygerberg Sub-District Health Forum.
Danny Du Plessis, Yalsi's River Health Cluster 2.
Thank you.
Felicity Daniels, Health Committee.
Samantha Stevens, Health Committee.
Valencia van Reenen, Health Committee.
Thank you.
Laronda van Reenen, Health Committee.
Ma'am, press yours off at the back. Thank you. Yeah.
Morning all. Crispian Swarbrick, CBD Cluster Health Committee.
Morning. Gay Abrams, Chairperson, Lady Michaela's Health Committee. Thank you for inviting us.
Thank you, ladies and gentlemen. And we officially going to start with the purpose of today. And we will be dealing with a very important matter. We all know that all these health facilities, there needs to be boards, there needs to be committees at local government level, there need to be interaction with the communities, and the department will, Minister, the department will outline and brief us and give us a presentation so that we can just, some of us are well versed with the programs and the processes, and some of us might be new, and this will then give us an opportunity to understand what this is all about. But Minister, maybe before we get into that, I'll give you an opportunity for opening remarks. Thank you.
Thank you very much, Chair. We're here today to present to the honourable members of the Standing Committee of Health and Wellness regarding the Western Cape Health Facility Boards and Clinic Committees Act. This is a provincial piece of legislation which was enacted in 2016. It is established to create representative and accountable boards and clinics as statutory bodies. The purpose of these statutory bodies is to enable responsiveness of the management of our various health facilities to communities and for the needs of patients. It is also intended to enable community support for and the involvement in health facilities and their programs. We have multiple facilities that have boards and committees representing them in both metro and rural districts. Just to put it into context and the scale of the operation that this Act requires of the department on an administrative level, We have over 249 primary healthcare facilities. We have 3 tertiary hospitals, about 15 regional hospitals, and about 33 district hospitals. So all of these require community involvement and representation. And we have support via community liaison officers within the department to try and help us establish these statutory bodies. I'm very pleased to see many of the board and clinic committee representatives in the chamber today. With that, some opening remarks, I'm going to hand over to Ms. Nkosi to take us through the presentation that we've prepared.
Thank you, Minister. Over to Ms. Ngozi.
Thank you, Chair and Minister, and to the committee members for the opportunity to take you through our presentation as the department on indeed the implementation of this particular act in as far as it relates to the constitution and training of the statutory structures. So the presentation itself will cover these 5 broad topics. The first one speaks to what Minister has already spoken about in her overview, which would be the overview and the purpose of the Act itself, and then the context within which we are implementing the Act at this present moment, and then take you through the status of the clinic committees and health facility boards in the metro, and of course those that are in rural, and then conclude and the way forward. So if we look into the overview and purpose of the Act, it is indeed to establish the statutory boards, the hospitals, and then the clinic committees at the PHC facility level. It is to promote community engagement and accountability in health service governance. How these boards are then established is that for the health facility boards, we are looking at a maximum of 14 members, which are a combination of community members, clinical experts, as well as technical people onto the board. And also for the clinic committees, we're looking at a maximum of 12, half of which at least should be community representatives, and also then representatives from the municipal space through the councillors. The functions at high level of these statutory structures is an advisory role to management at facility level. It's to facilitate community input into health service delivery, and also to strengthen the relationships and the interface between the community and the facilities themselves. The support that these structures are supposed to receive then from the department is for the department to provide them with meeting spaces and also the administrative support that will enable them to exercise their oversight function, and also importantly, of course, to provide training and induction of members into the roles that they will then be assuming as part of these statutory structures. Then the governance and powers that the statutory structures have in relation to the health facility boards, they are indeed juristic persons, and they can also hold property and fundraise at the level of the health facility boards. And at clinic committee level, they are limited, those powers, mostly to the advisory function, really. So if we come to the part around the context of these statutory structures at this point, we appoint them for a period of 3 years, and most of the structures that were in place expired around June and July of 2024. And this was, if we could all recall, also the transition period now at the provincial and national level, with the change in administration from the 6th to the 7th administration. And then when our new minister came into office, we then extended the terms of the existing clinic committees and health facility boards to allow for a process of then recruiting for new committees. And these extensions for a period of 6 months expired around January of this year. So to then constitute the new structures, we had to go through the process of determining those members who were still eligible and importantly available to serve another term. and where then we are not meeting the minimum numbers as required by the Act, we then had to go on advert and also do active headhunting for members to then be brought onto these two statutory structures. And how we interface with the statutory structures in the department is mainly through a decentralized approach. One would appreciate that with a big and a vast province as ours, that the model for engaging statutory structures is decentralized to the district and sub-structure level. And we also at facility level have these community liaison officers, or in other cases, designated staff, because we have not appointed community liaison officers across the province. In other spaces, the function is allocated to a designated person to oversee how the structures are constituted and that they are functioning at the local level. There is then also support that is provided by the district or the substructure office, and also from the provincial office, where everything is coordinated and put together. Just maybe for orientation again around the requirements for a member eligibility and for nomination into these structures. For the facility, hospital facility board, the membership there requires that these be people that are representing the community, and preferably persons with technical expertise. We also include heads of the facility, the head of the hospital itself. We have got clinical staff representatives, also non-clinical staff representatives, and also people from the academia, if the nature of the facility itself is a training institution, in the case of our central hospitals. For clinic or committees, the membership is one or more councillors, also the members of the community, who must, as I had indicated in an earlier slide, have to make more than at least half of the membership, and also the head of that PHC facility becomes a member of that clinic committee. Then if we look at issues of eligibility, who then is eligible to be a member of either a hospital facility board or clinic committee, they need to be a resident or citizen rather of the Republic, older than the age of 18, and they also have to have been unrehabilitated insolvent, must not, excuse me, they must not be an unrehabilitated insolvent, and obviously must not be convicted of certain offences, and must demonstrate a commitment to serve the community and also support the mission and values of the health facility that they would be appointed for, with a high level of personal integrity and honesty. And the biggest hurdle that then comes with this process of eligibility is that we need to also have a fingerprint verification and clearance from the authorities. And this is normally one of the biggest stumbling blocks, because even when people have interest, then that interest wanes when they know that they have to go through this kind of onerous process of fingerprinting verification. Also, the nomination by community bodies, it requires that we get a full name and address of the body concerned, its constitution and founding documents, the CV of a person being nominated, and also the motivation and declaration of the willingness of that particular individual to serve. Councillors are also, as members of these structures, have to be then nominated by the municipal council, and therefore there would need to be a council resolution that would speak to the official nomination of those councillors. And then in cases where then business expertise are then brought in, those would be either from the law fraternity, from finance or accounting, and other relevant areas that would be required for the effective functioning of a board or a clinic committee. Then the detail that follows at this point, Chair and members, is then the status of the constitution of these structures, And we're going to start with the clinic committees in the metro area. So if we look at the metro is divided into 4 substructures. The first being Khayelitsha Eastern substructure, then Klipfontein Mitchells Plain substructure, Northern Tygerberg substructure, as well as the Southern and Western substructure. So at a global level, we can see there the clinic committees and clusters amount to 48. And out of those, the number that has been constituted at this point is 8. Those that are in process of being constituted, where the appointment processes are being finalized, is 37. And the remaining committees that must still be constituted, which are currently not constituted, is 3. So when we go into the detail of each of these substructures, then we can see that with the Khayelitsha Eastern substructure, out of the total of 11, 1 is now already fully constituted. The appointment processes are in progress for the remaining 10. And the status, particularly in relation to this, is that now all the nominations from the different stakeholders have been received, including the one that has been long awaited from the councillor. And we, in this regard, we really appreciate the efforts from our minister to engage with the local government sphere to really assist the department with this process of the councillor nominations. So following that intervention, we were able to get those councillor nominations. And then once the fingerprints have all then been finalized for the remaining 10 structures, we would then be able to fully constitute the Khayelitsha Eastern substructure clinic committees. Moving to Klipfontein and Mitchells Plain substructure, again, there are 13 committees. At the moment, all 13 of them are underway in terms of the appointment process. There, again, we have finally received the councillor nomination. We are awaiting the results of the fingerprints for the members, and the administrative processes then are underway because you will then receive all of that package from the community liaison officer, and then it's submitted to the office of the minister to then authorize the appointments as the competent authority to do so. Looking at the Northern and Tygerberg substructure, there we've got 12 clinic committees, 2 are already constituted, and the 10 are also at the same stage where we are finalizing the fingerprints clearance, and then the administrative documentation then that comes with that, so that we can have the appointment letters signed. And lastly, then at the Southern and Western substructure, here we have got 5 constituted, 4 are undergoing this process of finalizing fingerprints and submission of documents, but we then also have an additional 3 that are not yet constituted. And then in the next slide, then we would speak to, oh, it's not at this slide, it's actually at the end, where we talk about the 3 that are not constituted. There, we are then still going through the processes then of headhunting members for those structures. If we then come to the status of the hospital facility boards, we've just concluded the clinic committees. If we look at the health facility, hospital facility boards, we can see we have a total of 19 hospital boards. 13 are constituted already, and appointment processes are being finalized for 4, and there is only 2 that are not constituted, and that is in the Southern and Western substructure. So again, if we look at the status of the health facility boards, in looking again at, I think in a different format, again, looking at the 13 that has been constituted, the 4 that are being finalized, and then the remaining 2 that are not yet constituted. And those 2 are Brooklyn Chest, DP Mare complex, as well as the Alexandra Hospital. we have received the nominations from stakeholders in relation to these two hospital boards. We are now busy recruiting for new members and also headhunting for community members, because we have not received all the adequate number of members that we were looking for in relation to these two specialized hospitals. Then if we come to the status of training of this structures in the metro, we can see that for the health facility boards, training did take place both in the previous term, and it has also started in the new term for some of the facilities. If one looks at, for instance, Westpleia Hospital, the training has taken place in March 2025, which means then it's already the new committee that has been trained. But in the other hospitals, it is the previous hospital boards that were trained, and once all of the processes for the current committees have been concluded, then training is going to then unfold for those new facility boards as well. If we then move on to the clinic committees and hospital boards status for the rural health services, which is all of the facilities outside of the metro, we can then see there that on the health facility board status, we have got a total of 26 in rural, of which 17 are already constituted and 8 are in the process of being finalized. And there is one that is still not constituted. And again, here, we have received a nomination from stakeholders. The one thing that is still also the main hurdle is in relation to documents being incomplete as a result of the outstanding fingerprint clearances. And the CLOs are then recruiting for new members where we have not yet fully constituted the structures. If we look at the different districts in rural, we can see that for Cape Winelands, we have constituted 6 of the hospital boards. Out of the 6 hospital boards, we've constituted 5, and 1 is not constituted in Cape Winelands. In Central Karoo, we have got a total of 3 facility boards, 1 constituted and 1 is in the process of being finalized. So we have none there that is not constituted. In the Garden Route, 7 total, constituted is 5, and we are in the process of then finalizing the 2. In the West Coast, out of the 6 facility boards there, we have got 4 that have been constituted and 2 are in the process of being finalized. And in Overberg, out of the 4, 2 are constituted and the other 2 are being finalized. So out of a total of 26, we've constituted the 17, 8 are in the process of being finalized, with then the 1 that is in the Cape Winelands that is really not yet constituted, for which we are then undertaking the processes of actively engaging in headhunting processes, because it does happen that in some of these places there are no nominations that have come forth, and then the CLOs then working with the facility have to engage in headhunting for members. And then if we look at the clinic committees then, and on the rural side, we have got a total of 105 clinic committees in total, of which 48 have been constituted. 39 are in the process of being finalized, and a total of 18 then is not constituted, of which these are found in Garden Route, in Cape Winelands, as well as in West Coast. So when we get into the detail, then we will unpack which are those that are not yet constituted. So in Overberg, we don't have any that are not constituted. The 1 is in the process of being finalized, and that is the process that is underway then because of an outstanding councillor nomination in that case of Overberg. In the Central Karoo, we also have a process underway to finalize the 6 clinic committees in the Central Karoo. We have received the nominations from stakeholders, and we are now just undergoing the administrative processes, completing the fingerprint clearances, and then make the submissions for these to be signed off. In Garden Route, we have a higher number there that is not constituted. We have 6 that are not constituted, and there we are then embarking on those processes of active head hunting as well for new nominations so that we can complete the number that is required to constitute a clinic committee. In Cape Winelands as well, the same situation is prevailing there. We have got 8 that are not constituted, and we are also again undertaking recruitment and headhunting for community members so that we can have an adequate number to be able to constitute and then take the process forward. West Coast, we've got 4 such unconstituted, and again, a similar process is followed there as well. We go out and we request for nominations. When we do not get, we must then go through a process of headhunting supported by the CLO, the head of the facility, and also other indirect interventions then that have to be made in that regard. If we look at the status of training in rural, we can see that for the health facility boards in rural, the same has happened, that these boards were trained in 2024 and before for the previous term. And for the new term, you can see that it is Worcester Hospital only that has been trained, because it has been trained now in March 2025, as well as Langsberg that was then constituted for the new term. Then if we look at reflecting on the status and where we are at in relation to constituting these structures and training and all of that, we can conclude that the actual process to constitute the new structures is challenging and has been challenging for various reasons, which include finding willing members, because people must still be willing to serve a second term, and if people are not willing to serve a term, then we must go out and advertise again. And then there were also these delays in getting councillor nominations that needed a separate intervention to go through that. And the cumbersomeness of the vetting processes also is, as you can see, that it is a common feature across all the statutory structures, both clinic committees as well as health facility boards. Also from our side, there is a need to improve the way that we are training and orientating these statutory structures, largely from a logistics point of view, in terms of ensuring that we can relook the number of days that we must arrange the training, access to the training sites, and also the recent budget cuts did not help the process, because when we had to find ourselves with significantly reduced budgets, then in the prioritization that had to take place, we had to ensure continuity of service, and then the likes of then prioritizing training ended up then becoming a second priority, and the primary concern has been to ensure that we have continuity of service delivery. So all of these things have also impacted on the timing and the extent to which we were able to immediately commence with training and ensure that all committees are adequately trained. And also the turnover of members within committees themselves also impact then on the extent to which the members are trained. Yes, Minister.
If I may just add on there, just so that the committee has sort of full appreciation for some of the challenges. So, for example, we might have had a willing volunteer, but they completed the incorrect form, because there is then confusion whether it's the clinic committee or the hospital facility board. And then in each of those, there's categories of nominees. So if they're a technical expert or whether they're a community representative, there's different forms and processes, and very often these are submitted incorrectly. So we have to go back and resubmit all those forms. And then if they're a community representative, they're nominated by an organization. For that to be valid, we need to see the founding document or constitution of that nominating organization. And very often there are delays there because that organization might be very old and they have to dig up the constitution. Or if there's a case where it doesn't exist, that person's nomination then from that particular organization is no longer valid and we have to start all over again. In addition, for the fingerprinting, which we're all aware takes a very long time, it can take months. Sometimes what happens is we receive a report back where that nominee may have a criminal record, but the Act is very specific in what type of criminal offence makes them ineligible. So, for example, an offence where they were sentenced to imprisonment without the option of a fine. It would be theft, fraud, forgery, or uttering of a forged document, perjury, or an offence in terms of the Prevention of Combating of Corrupt Activities Act. Different types of offences are not necessarily covered by the Act. So in that case, we then need to go back to the criminal clearance to find out exactly what type of offence and then to understand whether that person is now no longer eligible or whether they might still be in terms of the Act. So there are layers of complexity to the appointment processes. I think I'll just add in there.
Thank you very much, Minister, for that addition. So if I move then on to our way forward with that context then in mind and the challenges as have also been perfectly alluded to by Minister. Also, the legislation itself was put more than 9 years ago, so it is an opportune time for us to review the effectiveness of the statutory structures in their current form and taking into consideration their formation and all of that. And so the department now is looking at a process of then reviewing the functioning of the structures based on the current legislation. We have also undertaken our own review of our long-term strategy, Healthcare 2030, which also highlighted a need for us as the department to strengthen community engagement, of which the statutory structures such as the health facility boards and clinic committees and other structures like your district health councils, your mental health review boards are a part of that. We need to strengthen that role and enhance and capacitate these structures going forward so that there can be a better interface between the department and the communities that we serve. So some of the lessons that we've learned so far from work that has been done, academic work that has been looked at, and also feedback that comes through the engagement with these structures is indeed that the process is cumbersome. Minister has given examples of exactly that, complexity in terms of the appointment processes themselves. And also then the need to improve engagement practices so that decision-making is much more representative, transparent, and effective at local level. So we have then started this process of the review of the functionality of the structures, and the review is almost threefold. It is looking at, first, how do we simplify the process of appointment and constitution of the structures so that we don't take a long time to set up the structures themselves? And also then once they are set up, the process of capacitating them so that they can be able to discharge their responsibilities. Then the review of the regulatory and policy framework so that it is much more enabling and not really restrictive for these structures to be able to exercise effective oversight. And also then to optimize ways of engagement between the communities and the department. So we are expecting to complete this work over a 12 to 18-month period, which will then culminate in a legislative review process that would be based on feedback that would come from this range of engagement processes, which include, amongst others, surveys that we will then do with present and past members of these structures, also focus group discussions with particular interested community members, so that we can then get all of the feedback that we need that would inform these three pieces of review of this whole functioning of the statutory structures. because it is really our intention as the department to engage with communities more, as well as statutory structures, because we appreciate that they are a key enabler in ensuring that the voice of the community is considered in the planning, delivery, and also governance of health services in the province. With that, Chair, I will then bring the presentation to an end and ask Minister to then add. Thank you.
Over to you, Minister.
Thank you very much, Sinkosi. So as the committee can see, this is an enormous administrative operation to be able to realise. Unfortunately, in many cases, we simply do not get enough nominations to be able to constitute the committees. And it's something that we spend a lot of time trying to recruit members. We have advertised, we ran a Become a Health Hero campaign. We even developed a QR code. So we've been trying as hard as possible to let it be known in communities that they can participate in their health facilities and to encourage people to become a health hero. We're also working hard to headhunt, especially technical expertise, and to really find excellent people with knowledge of that specific facility or ecosystem as far as possible. Some boards and committees have never been constituted, and we're working especially hard on those because we would like to see all boards and committees established. But as we've mentioned in the presentation, we would like to have a legislative review to see how we can make this simpler and easier to do. So, for example, would it be desirable to have longer terms? We have prepared a survey for the clinic committees and hospital facility boards, because we'd like to get feedback from them on their experiences of the appointment process, of the training. And this is a first step in being able to improve the status of things and the first step in the review. Those surveys should be going out imminently. To those that are constituted, and as in the coming weeks, you'll see a very different picture as we're almost at the finish line for the vast majority of the boards and committees. And in time, then we will come back to this committee for your support in the legislative review. Thank you.
Thank you for the presentation. And I had a quick look on the compilation, the members of this committee, and I've noticed that the majority of us are former councillors. So a lot of the stuff rings a bell. This is just at the highest level. So members, I'm now going to allow ourselves to interact with the presentation, questions, comments. And once again, I'll start with the members in the chambers, and then I'll go to the members online. And members online, any comments, questions, if you may make use of the raise your hand function, and we will come back to you, Member Van Wyk.
Thanks, thanks, Chair. Yes, I think thank you very much for this report and this briefing. I think it's probably timely to also have a look at it. And I think, as you've indicated, after a number of years to go through the review process, and I suppose in sitting here, as Chair has mentioned, coming from a local government environment and having been in a position where I've had to, as mayor, to nominate members to the committee, I suppose what comes up with me here is, one is perhaps the communication process, whether that communication process is effective enough. And in part of that, I think it is also whether those of us in local government or within communities fully grasp what is expected here of these committees or the boards and the role that they fulfill. And then I say to myself, I suppose what needs to be done is the question of effectiveness, of how what value add do these committees or these boards in reality give, and it's probably something, an evaluation that needs to be taken on the side of the health department as such, on the one side, and possibly those committees and boards themselves. I know within the audit committees in local government, there is a process now of self-evaluation that they go through, and they need to evaluate themselves in what they have done. So, and then the question I just ask myself is, you go through what is a pretty, must be fairly cumbersome, and as you've mentioned, a big administrative process to get to that level. And the question is, have you got the right people that are sitting on those committees and on the boards? And to really give that level of insight, because it's almost a form of non-executive governing board. So the persons holding those positions, it's not just a simple committee position. It's you need to be adding some form of value if you're sitting on that committee, and be dedicated to being of assistance in doing that. So I suppose those are just my reflections on it. And I suppose what if in undertaking that review, whether one has perhaps got to go back to the actual act, say to yourself, are we actually achieving what we wanted to achieve? And how does one improve the system? Thanks.
Thank you, Member van Wyk. Member van Minen.
Thank you very much, Chair. I really think that hospital boards are incredibly important tools of facilitation, communication. It's the link between the hospital and the community. And I think that in South African reality, there's quite a lot of misunderstanding that can creep into that sort of situation. People generally only access hospital services in a time of need, in an emergency, in times of crisis. And they have sometimes got a certain viewpoint that they don't always believe that needs are being met, because they don't always understand the enormous constraints and circumstances that hospitals have to operate under. I think that hospital boards and clinic boards are really important in this relationship. But in my observation of their workings over the years, I have been concerned, as my colleague has expressed, one can only be as good as the people on those boards, and very often it's, as has been expressed, difficult to get people to step up. And then very often the people who do step up are incredibly well-meaning but aren't always capacitated. And certainly where I live in the city, there appears to be a certain amount of pushback sometimes from the hospital administration, who are very unwilling to cede any kind of space to hospital boards. And so they're quite negative sometimes towards suggestions and conversations with them. So I think it's something that we really can invest a lot of time into, because I think they add an incredibly valuable service and an incredibly valuable line of communication with people. And they really do need to be, I think, capacitated on an ongoing basis throughout their term. And also, I think in terms of getting the right people or getting capacitated people to serve, it's difficult. I mean, I live in a community that is large and diverse, and we have a lot of very, very capable people. But firstly, I think a lot of them don't know about the hospital boards. There's very little publicity. And then getting them to actually step up and serve is also a problem. So I think we should really be putting a lot of attention and emphasis on that. And I think, if I may, Chair, propose to you that any help that the standing committee can give, I think, would probably be very valuable. Thank you.
Thank you, Member. Member Van Vogel.
Thank you, Chairperson. Chair, I think it can really be challenging to review a presentation thoroughly when received just an hour before the meeting. Having a presentation in advance allow us at least to prepare better, because we just received it now an hour ago. So I don't know the reasons and why, but for me it's unacceptable. Then secondly, Chair, I think I agree with my colleague, Member van Minen, that hospital boards and clinic boards is a very important part of the health sector. And I also agree with her when she touched on the issue of communication. I think there's a lack of I don't know, where I come from, it's there's not enough communication when it comes to even your recruitment drive. I don't know how you do your advertise. Are you what are you doing when you advertise there's new boards? We are going to establish new boards. I don't know the process. How do you do it? We were appointed as members to different hospital boards by the minister. And I'm serving on one of the boards in the Swellendam area. And what I pick up in your report is that I'm referring to the Overberg report. You only report on clinic committees. It's saying clinic committees 14, constituted 13. So I'm not sure, am I missing perhaps a page or something when it comes to hospital boards? Because it's two different things. You have the hospital board and then you have the clinic committees. But the report here is only speaking on clinic committees. And it will be wonderful if at least we get a report from the department telling us the exact same thing that you are doing with the clinic board when it comes to the hospital boards. Because I know I'm still serving and it's still the old board. And you remember in your report, you mentioned that there was an extension up until January, if I'm not mistaken. And where I am sitting, I'm still from 2 years back, nearly 3 years, if I'm not mistaken. It's still the same board. It's nothing new. And most of the time we are struggling to correct. So what is in place to monitor these boards at the moment? And it's not new. I think in my previous term, I mentioned it, monitoring of hospital boards, support to hospital boards. We are sitting here actually with experts when it comes to hospital boards. Why are you not using those people who are actually the best practice? Ek weet nie wat is die mooi woord wat ons kan gebruik nie, maar in Engels nie. Maar dis mense wat goed doen. Why are we not using those experts? They are experts in their field to support those struggling boards. Because what you do, you send us to some institution as hospital boards and clinics, and we get trained, and then voila, no support, no mentorship. So I think you really need to look at ways how to support hospital boards and not just train them and disappear as a department. Use those who are experts, who are really doing well while they are serving on those different structures. Chair, then I think the minister touched on the criteria. That's actually very good, because I really want to understand, except the criminal records, what else are you considering when you appoint any person on the board? The reason why I'm asking, I received a message from one of a previous member we met when we went into an oversight in at PAL Hospital. He was one of those members who will send issues, engage the manager at the hospital. He was one of those, I think I even sent it to the chairperson, where a patient was waiting to be assisted and died in a wheelchair. He was one of those active health workers, board members. And when he applied again now, it was declined because he's receiving a salary as a private business person. So I really want to understand the criteria. I will send the details of that person to the office of the minister, because he was a very active hospital board member. Yeah, so in terms of the criteria the minister mentioned about the criminal record, I really want to understand what are you looking at except that. I think for now, Chair, let me park there.
Thank you, Member. Minister, just some advice. There are still members online as well, and I see that they've raised their hands. Would you like me to do that as well, or do we deal with this and then we go to those online? What would be preferable for you? We've got 3 in-house and 3 online. All right, members online, we will come back to you. We will then now deal with the responses to the members in the chambers. Thank you for your indulgence. Minister, over to you.
Thanks very much, Chair. I'm going to start with some of the answers and then I'll ask my colleague to fill in. Some of the questions do overlap, so I'll try my best. So on communication, it's multifaceted. So we have made a concerted effort to communicate that we are looking for health heroes. So as I mentioned, I've done media releases. The department has advertised in newspapers. We've had various social media campaigns, but that, you know, it is clearly not enough because we need much more knowledge about where in particular we're looking for volunteers and for there to be a kind of word of mouth spread about the various facilities in conjunction with the community liaison officers that go and then engage different organizations and say, do you have suitable people in mind to nominate to the boards and the committees? Then, you know, on the value, I mean, the boards and committees, generally speaking, are, you know, a huge asset to the department, and we really value and appreciate having those representatives from communities that support our facilities. Many of them are very active in respect of boards. They do some very good fundraising, which is very welcome at the facility level. And clinic committees, they host open days to facilitate public interest in the facility. Very often they'll have nurse appreciation days. Some of them provide care packs for patients, especially in the district hospitals. So there are many initiatives that they undertake that are really very valuable and very well received. They're also very important in that communication and information sharing. Some of them have WhatsApp channels where they're able to keep residents appraised of what's happening in a clinic. For example, if the electricity is out for a particular reason, to help people to know, or if there's new developments, if we're going to have some infrastructure development or whatever the case may be, they use this as a way to communicate. Otherwise through community meetings and things like that. And we'd like to see much more of that, because I think the more we can do that, the more we will have interest in participating at the facility level. We do need to have a deep look at the Act and are we meeting those objectives, or how, let me rather put it like this, how can we better obtain those objectives without necessarily this very large administrative burden that goes with it. And once those boards and clinic committees are established, how do we have that ongoing communication? So we do have training, but initially the training, I mean, I felt was far too long. I mean, in some cases it was 5 days, and for somebody to take 5 days off work to attend training, I think, is unreasonable. So that has now been reduced to 1 or 2 days. But how do we make that training more accessible? Can we have then add on modules that could be virtual or on a weekend or something like that, where we could continue to capacitate clinic committees and hospital facility boards? So that's the direction we'd like to go. But before we do that, we'd like to engage with the representatives themselves via the survey that will help us to understand if this is something that would be helpful for them. Another thing that we'd like to get to is to then communicate the good work that the clinic committees and the hospital boards do, because I think if people could see, what a rewarding space this is, maybe more people would be willing to participate. Then the rural hospital facility boards, it's on slide 22, that shows the breakdown of the hospital facility boards. What do we consider when making appointments? So it depends on the type of appointment. So across the board, obviously it's, being a South African citizen, older than 18, and then not an unrehabilitated insolvent, and then can't have a criminal record in respect of certain criminal or types of criminal cases. As I mentioned, if it's a community member nominated by an organization, that organization must have a founding document or a constitution. It also can't be a party political organization that nominates. If it's a technical expert, their CV has to show expertise in law, finance, business, or accounting, or a skill that myself as the minister deems appropriate for that specific facility. But also to bear in mind that there are term limits. So some people, although they might be willing and might meet the criteria, they might have reached their term limit and would then no longer be eligible to serve again. And then this is one of the questions, is a 3-year term, perhaps that's too short. If we were to make it slightly longer, where we do have excellent representatives who are still willing to take on or to serve for a longer time, maybe that would be an answer. So that's the kind of thing we'd like to ask, is that maybe a way forward? So that might be the reason why this individual was not eligible, but I don't know the full detail. If you send me the detail, I'd be very happy, Honourable Winful, to find out more.
Thank you very much, Minister. I think you have covered all the questions. Maybe just to re-emphasize, I think the issue of communication is one of the things that we would like to also, as part of the review work, see how we can improve communication across the board, whether it is about the recruitment processes, about the ongoing training, and also continuous support and engagement that happens between the boards and the communities and the department itself. And I think it will be a critical feature of the review process itself. And I think, as members have also confirmed, the whole issue of how boards can help to bridge, I think, the strategy implementation from the department side is such a critical element. And I think it is quite appreciated by the whole department itself. Fresh coming out of our Indaba and our strategic planning sessions, where we were developing our new plan for the next 5 years, where we're wanting to focus on people starting well, living well, aging well. Really, the role of the statutory structures in that regard is quite important in bringing the community side to it, to ensuring that people on their own also have the agency to start well, live well, and age well, and how we then strengthen communication across the board and ensuring that there's an enabling environment for statutory structures to function effectively at local level is one of those things that we are really going to be putting a lot of emphasis on. I think Member Venvogel, the point of the report received late is regrettable from our side as the department. We wish to apologize for that, and we will make sure that in future it is received in good time. It was just one of those, I think, administrative oversight on our side. We will certainly ensure that the report is received early. Yes. With regards to the process for the new boards, I think we said a lot of them came to their term came to an end in June, July of last year, but it was not all boards. Some of them are still in their 3-year cycle. It's just to say that the cycle is 3 years and it ended for most of them last year, but you would very well be in one that is still continuing. And then when that term comes to an end, we then elect a new one as such. So others are continuing, but the majority of them had then had their terms expiring. I think those were the elements I wanted to add. Thanks.
Members, if I can propose that based on the timing of the receiving of the report, anything else that we come across, we can submit that in writing so that we can, if there's anything over and above in the report, so that we can submit that in writing as well.
I'm not sure in terms, are you going to give us a chance for follow-ups again?
Yes, I will.
Okay.
Members, I'm coming to you on the virtual platform, and it will be in this order: Member Stevens, Member Jacobs, and then Member Walters. In that order, please. Member Stevens.
Thank you, Chair. Thank you, Minister. Most of the questions was covered by my colleagues, but I just want to know, due to all the delays to appoint the board members and the committee members, what is the time frame? I think the minister said it's 18 months on fingerprints and compliance check if the board members can only serve for 3 years. So by the time the fingerprints come back, then there's only like a year and a half to serve. So like the minister said, they are looking into it to make the term longer. I will suggest that they really do make that time frame longer, because if it takes 18 months to clear a person, then they've only got like a year to serve, and when they really started getting into serving, the time frame is finished, and then the whole process must start again. And on training, on standardized training, how do they monitor it, and do they also give follow-up training sessions on the training, Chair? That's mine for now. Thank you.
Thank you, Member Jacobs. Member Jacobs.
Thank you. Yeah. Thank you, Mr. Chair. Greetings to all. Yeah, Mr. Chair, I just wanted to find out. So with regards to the members of the board, when they are being elected, I just wanted to make sure, how is that information being filtered through for when it comes to the community, the broader community, because we find that we have health professionals that don't work anymore, that is at home, or people that have had knowledge that is at home, but when they apply, you find that these people they don't get in. And then also what is the board members now. When are they? When we look at what's happening in our communities, there's no health programs that is happening anymore in our communities, at our schools. I think when it comes to the board, they need a little bit of extra training, because when the board have information that they can put out, let me make an example. Say, for instance, it's winter, and there's stuff that the board put out that people can use, they can do at home, then it will almost prevent the hospitals from being so full. I'm just making an example. There's certain information that they can put out to the community, stuff that the community can start doing, healthy eating, ways of doing things in a healthier way, so that we can have less people running to hospital, because they will know what to do at home. But we find when it comes to the board members, hey, I don't want to be rude. I've been to a couple of hospitals already. Then when we've been introduced to the board members or the health committee, you find that most of these people don't even know half of what's going on. Some of them is never available. So I just want us to focus on that, make sure that the board members, they get more training. And I also just want to latch on to what the minister said about the WhatsApp groups that they have and how they send information out when it comes to certain things like your job opportunities or your infrastructure development. So when you come to most of the sites, you ask yourself, when did this information go out through our community? Because when you look at the people working there, you find that it's not even people from our community. So I'm just saying there's a lot of things that is not really working when it comes to the board in terms of how things are being filtered through. For instance, in Mitchell's Plain, when we look at the district hospital, there's so many issues coming out there. People are dying. I just got a report now from a lady that says a mother fell. The ambulance came to pick up a mother by 12 o'clock. They took the mother in. They told the family that they can come by 2:30 for visiting hours. 2:30 when they got there, the mother was dead. But they were the first people to find out that the mother was dead. The people at the hospital didn't even know themselves. So I'm just saying there's such a lot of things happening and you don't see the board really putting focus on it. And I just want to know, is the board really delivering on the mandate that they are supposed to, or are they just there as curtain raisers? You understand what I'm saying? Because there's such a lot of things happening. But what I also want to bring over is, yesterday when we had a meeting, we spoke to the Minister of Social Development, and he made a very good point. Because sometimes you find board members are all elected and they are all from one particular party. Let's be honest. That is how things are working. The minister made a suggestion and said, you know, when we select these boards, sometimes we must make sure that we have members that also represent different political parties. Because whether you like it or not, politics plays a role in everything. So when we can do it like that, you'll find there's a diversity of different political parties, there's different people there. You will find services being handled in a different way. So that is just my 5 cents that I want to throw in. I will come back when I have more, because remember, we only got this presentation now, so we couldn't really go through it. We must just now see what we can get and so on. But yeah, thank you for that opportunity.
Thank you, Member Walters.
Thank you, Chair. Can I just say that I think it's incredibly useful to have this kind of report in front of us, because I think it speaks to really what systems of public participation we have that speaks towards the goal of health. And I think there's a lot of comments of members that I agree with, so a lot of comments that I think can be further debated. But Chair, and I also want to avoid using anecdotal stories, things that I've picked up. That's things that I will individually take up with the Minister and with yourself, Chair. So I'm going to try to limit my comments to call it of a more systemic nature. Now, looking at the presentation and listening to the department here, I think it sounds like there are 3 main, call it strategic challenges to a good system of public participation around health. One is the attraction of talent across the board, a diversity of talent, talent that has a strong connection to the community, talent that brings in a certain expertise that you require. So that's the one very simple first thing that I'm picking up. And Chair, I believe that would be a useful frame to assess the health of that going forward. If there's measurements and outcomes and systems that we can monitor, and I think we are dealing with a department that's good with data, collecting and interpreting and reflecting data, evidence. I think the second challenge that I pick up here is the ability to, we use the word in South Africa, capacitate, but build capacity. People that once they are on these boards, that they play an increasingly positive role that becomes an asset, not a further administrative responsibility. It turns a situation, and I'm using perhaps an overly extreme example, but you're not dealing with flogging a dead horse. You are riding a racing horse in terms of contributions that such a body is making. So the second thing is capacity building. The third aspect, and I think, Chair, this is one perhaps influenced by what we saw in Member van Wyk's committee with a schools evaluation authority. I'm not suggesting another a big structure, but the approach I like there is finding ways to assess the effectiveness of such boards, that we on an ongoing basis can actually have good comparative, call it case studies and examples, good practice examples from board to board. So there's the third challenge and the third, call it, problem that needs to be solved of how do we evaluate both quantitatively and qualitatively the efficacy of these boards. So, Chair, just to summarize, and I would love to hear the department's comments on it, but it's also in a sense speaking towards a recommendation going forward. It's attracting talent, building the capacity of that talent, and measuring the effectiveness of the boards and the talent that we've attracted. That's what it sounds like to me are the challenges. And Chair, and then maybe to put it all together in a very simple question, does the department agree with that sort of breakdown? And if so, what are their comments on each one of those three challenges? Thanks.
Thank you, members online. Minister, over to you and the team.
Take the first attempt at answering the questions. Thank you to the members. So in respect of timeframes, the fingerprints can take up between 3 and 6 months, because we do know that there are some backlogs. Sometimes it can be shorter. It could be, 6 to 8 weeks, but it really just depends, and that's if there aren't any complications. As mentioned, if, for example, there is a positive result that comes back, and we'd have to then understand what is the nature of it and so on. But Honourable Stevens, what I'm doing is making sure that once we've got all the processes done and everybody that's been nominated have all their boxes ticked off, to then constitute the board for the 3 years from the date of that signature. So that's we'd rather have the delay before the appointment process, so that once that board or committee is established, it is then for the full 3 years as intended by the Act. So sometimes it takes us a little bit longer. The other frustrating thing is that we might have 99% of the members ready to go, but we're missing a particular document for one of the nominees, and in which case we cannot establish the board or the committee. But, these are all the things that we deal with daily. Then Honourable Jacobs, on the communication, I mean, that is exactly the intent, and what we'd like clinic committees and hospital boards to do is to share public information. So, for example, in the winter season, how do you keep children safe from burns? In the festive season, what are some safety tips, and so on and so forth, which the department produces regularly and all the time, vaccination campaigns, etc., etc. So we're also putting some thought to how, from a head office, we can provide some of these materials to the boards and clinic committees so that they can share those out with their communities. That's not necessarily facility specific, but is general to all wellness and well-being, etc. And then from within their own facility specific information as well. Just a note that in the Act in Section 10 are the requirements of the boards and what is being asked of them to do, so that we have the correct expectations of what the boards and committees do. In the appointment, there are prohibitions on party political organisations nominating representatives, and I think the intention is for these boards to be, have the interests of health and wellness at their core. Then, Honourable Walters, I would agree with your assessment in the 3 points: attracting talent, building capacity, and evaluation. So in attracting talent, again, it's about communication to make sure that we have, that we can call sufficiently broadly for that talent, as well as all of your support in spreading the word. And then also showing what can be achieved by working together, community and health facilities, building capacity is then through our training and ongoing communication, and then evaluation. And I think we're at that pivotal moment now where we're going to evaluate the length and breadth of this legislation and how it works, or where it could work better.
Additions?
Thank you, Minister. I think you have adequately covered the questions this time, so we can.
Members' follow-ups? Member Van Vogel?
Thank you, Chair. Chair, I think when I look at the slide, I will refer to the overbook because that's where I am deployed. It's really not a true reflection. And the reason why I'm saying that is because out of the answer of Madam, she mentioned that the report is there's the board that I'm serving on is perhaps a board in, I will say, in a grace period, nearly the end of their term. That's the answer that you must correct me if I'm wrong. Perhaps, or was it the minister, perhaps the board I'm serving on is in this grace period, nearly the end of their term. That's why we are still functioning. But there was boards that terms entered somewhere in January.
So just for clarity, Chair,
Yeah.
are you on were you on Swellendam?
That's right.
Swellendam has expired and is no longer operational. Your terms have expired.
Okay, so they are not
The original
operational.
appointment letter, it would have given the date at which the term expired. So currently the Swellendam Hospital Facility Board is not operational, but it's one of those that is now in process of gathering the new representatives who will be appointed once we have all the relevant documentation in place. So
Okay.
currently Swellendam is one that is in process.
It's not?
Process.
It's in process. That's why I'm saying it's not a true reflection. It's not. Because if you look at your report, there's none under overburden, none.
Which slide are you on, member?
On page 22, not constituted, there's none, there's a 0. But then the minister is saying Swellendam is in a process. Then when we get to Teerwaterstoof, Grabbo.
Sorry, member and minister, you'd correct me. My understanding of not constituted means that the new board, all members have not been accredited. Is that my understanding?
I don't want to, I really don't want to go into, no, let the minister answer. Sorry,
Okay.
Chair.
Yes.
So when the term comes to an end,
Yep.
the board expires.
Yes.
All right. We then have to undertake a process to appoint a new board. Right. Now, in the categories, you'll have constituted. That means the board has been reconstituted and every eligible member, according to the categories, has received an appointment letter and that board is rolling. Okay. Then we have a category where we have all the paperwork in place, but we're waiting for the final results of the fingerprints, which means we're almost ready to sign letters and appoint, right? And then there's the third category, which is not operational, which means we are not near being able to constitute, in that we're not even at the point of getting fingerprints. We don't have sufficient nominations, or we don't have a technical expert, or we don't have a counselor. That's what it means, is that we are not anywhere. We're not in the process of being able to constitute the board. We are kind of in early stages of trying to recruit for that board. So in those cases where it says not constituted, it means that we still have a lot of work to do to get it. In process means that we have everything that we need, and now we're waiting for those final elements, whether it's to see the resolution from council or to get the fingerprint result, in which case And it might even be just for one person. We might already have it for everyone else. So we're in that category. What it means is that we're very close to being able to appoint the board or clinic committee, as the case may be. Hopefully that clarifies.
I understand it, Member Van. Now I'm saying I'm understanding the explanation.
Oh, yeah. So what I'm saying, I will repeat it again. It's not the true reflection. Because there's still Swellendam. I don't know. I will send you even on the health committee board, hospital board. There's nothing about you need to. It's your term has end. The chair was asking for a meeting. So it's not the true reflection, Chair.
Should be an error.
Sorry, member. Minister.
Your appointment letter would have given a date on which your term expires. So all those members would have then expired. So we'll look into this specifically.
Yeah.
So just for my understanding as well, member, are you saying that board has not expired? The members are not aware that
they're not aware.
All right. Okay.
Yeah.
All right.
The doctor and the district is serving on that board.
All right. Okay,
Then,
Minister, I think that
you do a follow-up
to that, yeah.
Yeah. Yes, thank you, Chair. So yes, we agreed it's not the true reflection. Then secondly, Chair, I think on page slide 10, when you say appoint process being finalized, what exactly does that mean? And what is the proposed time line for finalization? That's on your page 10.
Just for me to understand, member and minister as well, I don't also want to be confused. What is the difference between not a true reflection and a misunderstanding? Because I'm picking up here that there's a misunderstanding amongst the members of the board, and the members saying it's not a true reflection. Now, which is which? Because I don't want to be confused on that level. The department is saying...
Department is not sure, ma'am, sir, Chairperson. They are also not sure at the moment if it was the end of term. She's going to investigate. For me, it is not the true reflection. We don't need to sugarcoat things, Chair. Please, don't do it as a chairperson.
All right, member, minister.
Yeah, I'd like to raise objection to that because when a person is appointed to a board or a clinic committee, it clearly states on that letter the date on which their term expires. So it is communicated in advance the date on which that person's participation comes to an end. And so if we have communicated that in our records, we reflect that as the date on which that particular board expires.
And that's automatic. When that day comes, that's automatic.
And then from then, that then triggers our process to then renew or embark on the process to constitute in the new 3-year period as required by the Act.
Member Walters? Oh, sorry, you're not done. Okay, sorry. Please put on your mic, member. I can't hear you.
Yeah, I'm saying that on page, I asked a question on page slide 10, when it comes to the proposed timelines and finalization, because I want to understand that. Then lastly, Chair, the Theaterskloof, also Overberg. I visited that hospital, day hospital of clinic, and there's also not a board. So really we try, because I was there with board members who resigned, who told me there's no board. The sister in charge, the manager in charge told us there's no board. But when you look at the report, it's something else. So thank you, Chair. I will stop there and park there.
Which one is that? Tiva the Skloof. Grabouw. So you're saying the members are saying there is no board? How long ago? Oh, yeah. They resigned years back. All right. Whilst we following up on that, just for my understanding to the department, when somebody resigns, so must that resignation reach you to be aware that there's a resignation? If not, you folks would not be aware that there's a member missing from the board or whatever. All right. So it's Grabouw, and it is the committee of the clinic. That's Grabouw. All right. So we need to follow up on whether those resignations have reached the department. Okay, that will be, can I make a recommendation, members? That would then be part of, the recommendations in terms of the department minister forwarding us with those details. Swellendam and Grabouw, committees. Yeah.
Can we also then add that we get a report where that reflects that these are the newly constituted hospital boards and clinics, and those are the ones that are near the end of term. If we can get such a report, the one of my recommendations, if Nomonde can just capture that part. Thank you.
I see the minister and nodding. Yeah, but just for my clarity, we are a new we're a new term, we're the 7th parliament, and we're dealing here with other terms linked to the periods of the legislature. All right, then I'll withdraw. I'll withdraw if it's not linked. I thought it's back to back, date to date. All right. But I've seen that the department have agreed that we will get that information, Member Van Vogel. Member Walters?
Yeah, Chair, I'm left a little bit confused. I would say it is an untrue reflection if there's a claim made that there is a functional hospital board and there is not a hospital board in existence. I did not get that impression. I got the impression that there's quite a reasonable handle on where hospital boards are functional or not. So I'm not quite sure whether the term it's not a true reflection, whether I agree with that. So I don't think it's necessarily we have consensus in the committee in that regard. What I do agree with is that we should fine tune exactly where each hospital board is, and I think it speaks to the points that I made earlier. That we have a sense of not just where hospital boards are in existence, but where they are in terms of their capacity, where they are in terms of their functionality, and also where there are not hospital boards yet in existence, where we are in terms of making sure that they are going to be in existence and where we are in that process. So I think there could be fine-tuning of information that we know exactly what we are talking about. But I'm not. I do not think we are dealing with some kind of a pro forma clumsy presentation where any information is being hidden from the committee. I don't think that's certainly not. I think I wouldn't agree with that. Call it characterization of what we're dealing with. But Chair, I think we are at the heading towards the point of recommendations as well. And I just want to test it again. If we, I'm certainly going to make a proposal that in those three sort of strategic challenges that I've suggested, that we look at assessing this going forward according to those three, call it challenges or three steps that I've previously referred to. I think there's a sort of a useful way to zoom in on monitoring the hospital boards, and also then it gives us an empirical basis to give our inputs. Thanks, Chair.
Thank you, Member Walters. I think your comments, we will formulate that in our recommendations. Member Brunkes, can you do two things, please, to introduce yourself and then ask your question for the record?
Well, thank you very much. Yes, thank you very much, Chairperson. My name is Khalil Brunkes. I'm not a member of this committee. I'm a member of the Finance Committee and of the Agricultural Committee of the Western Cape Parliament. And let me just say first, good morning to you, Chair, and good morning to the Minister, and good morning to all the colleagues. If I may proceed, Chair, with regard to this topic of the hospital boards and clinic boards, then with your permission, then I can continue.
Member, yes, you may.
Thank you very much, Chair. Chair, like I say, my name is Member Brunkes. I served on a hospital board for the last year or two here in the Helderberg, Somerset West area. And I was appointed by the previous term, the Minister of Health, Minister Mbombo. I was appointed by her office, and I served on the hospital board here in the Helderberg, called the Helderberg Hospital, HH. And I served my term there. The term came to an end now in the beginning of the year, January, February. Our term as board members on that hospital board, it came to an end. And I thoroughly enjoyed myself there, and I learned a lot. First time I served on a hospital board. And the experience was very useful in terms of serving my constituents here in the Helderberg. And I just wanted to say that I've listened to the discussion and to the topics that was raised now with regard to when a term comes to an end, or does it come to an end, and how does it come to an end. If I could, then I would first of all ask the minister just to clarify and to give shed some light on the aspect of how do we as members, how do we nominate ourselves, or how do we make ourselves available again to serve on these hospital boards again. I know there is a process to be followed, but if we can just maybe just be refresh our minds on how do we nominate ourselves and how do we go about to serve on those hospital boards again for another term. I will just leave it at that, Chair, for now. Thank you very much.
Thank you, Member Brunkes. Member Van Beek, I see your hand.
Thanks, Chair. Chair, I must say I am a little bit concerned that we have members of the Western Cape Provincial Parliament who are serving on hospital boards and want to serve on hospital boards, and I question whether there's not a conflict of interest in terms of serving on a body over which you are now having oversight. And, you know, there's certain comments that have now been made within this committee's meeting, you know, where members, you know, appear to have now sit in, you know, making comments on a body that they have oversight over.
Minister, over to you.
Okay, so let me just go back to the request for the documents. We're very happy to provide the information as per the members' requests and the resolution that might come from the committee. If I could just ask, given that there are hundreds of facilities, if we could have a little bit longer than the usual 2 weeks in order to provide the response, that would be very helpful so that we have the time to be able to package it in the way that the committee would like, so that you can have the full the information that you'd like.
I see the members are nodding, so there is a yes.
Okay, thank you. That would be enormously helpful because it just we have the information. It's just about time to be able to package it within the requirements that the committee would like.
So sorry, Minister. On that note, I just want to come back to the comment made by Member Van Wyk in your comeback to us, because I know my understanding is that at certain levels you have councillors who serve on the committees, and at certain levels you have members who serve. I don't know on boards, but definitely on all levels you have stakeholders, community stakeholders serving. So if you can get the clarity on that as well, so that we can all be on the same page. Then back to you, Minister. Thank you. Sorry for the interruption.
Okay, so the Act is written in a way in which a councillor is a requirement for, in particular, the clinic committees. So, for example, if we do not have a councillor nomination, we're unable to constitute that committee. However, the way the Act is written, there is a may, it's not a must. The minister may appoint a member of the provincial legislature to the hospital board specifically. I have, however, received a legal opinion that there is a conflict of interest in the mechanism for the appointment process of the MPLs. I'm therefore erring on the side of caution until I can properly understand this better, and this will form part of the legislative review to make sure that we meet good governance requirements in how those nomination processes take place. As you'll see in the Act, there's a particular mechanism for that, which goes by the Standing Committee, and the legal guidance was such that in applying my mind, I felt it was not prudent, and considering it is a may, it is not a must, in respect of the Act, that at this point I will not be making those appointments until I've had the opportunity to properly delve into the legalities and to make sure that should such appointments take place in future, that they meet the appropriate muster. There's also then the question of the various oversight responsibilities as a member of this House and an oversight responsibility as a member of a board representing a specific facility. So that work is currently underway, Chair.
So we make that part as the longer than the usual response to the committee, so that you can have full understanding of
the response.
Okay.
So that is part of the review process, which is the 12 to 18 months that we're undertaking at the moment.
All right. All right, thank you. I think Member Brunkes, you've heard that. You triggered this.
Yes, yes.
All right.
Yes, thank you very much. Yes, I heard that, and yes, that is quite clear. Yeah. I also knew that the Act stated that it's not a must from the minister's office to appoint a MPL, but the minister, the office of the minister may, according to the way they see it fit, appoint the MPL to hospital board. And that is how I was also appointed not long ago in the previous term.
That makes sense. That makes sense. Thank you, Member Brunkes.
Thank you.
Member Walters.
Chair, I think to me it is and I think these are the things that I agree with the provincial minister, that that it's something that's at the end of the day a legal question. It sounds like it's a separation of powers issue. It sounds like a possible conflict of interest issue. I just want to make the comment that whichever way it goes, and I'm sure we can all agree on that, it should be consistently applied. You know, I think that is I happen to think it should be completely deep, or shouldn't have party politics on it. But I do think and maybe I should state it very bluntly, and I maybe also to give assurances to people from other political parties, what is good for the goose is good for the gander. We can't have a situation where, regardless of who the ruling party is, that there's, in our instance, DA people and not people from other political parties. I think we should apply it consistently. That is a fundamental principle that I believe in. And so I suggest we also look at that as a committee, that there is consistent application across the board of whatever the outcome is of that legal opinion. Thanks.
Thank you, Member Walters. I'm also watching body language in here from the members as well as from the stakeholders. So we are all in agreement. And Minister, I think your proposal would really share light when we get your legal opinion understanding back to us and everything that goes with it. And the outstanding information in terms of what is happening in the different clinic committees and hospital boards, etc. So we will engage on this again when we get. Who's Mackenzie? Minister Mackenzie. All right, we're not gonna, sorry, members, point of order. Members, point of order, members, point of order. We will deal with information that would be tabled to us when we come back. Minister?
Just to respond to Honourable Walter's point, absolutely, it is consistently applied. I have not appointed any MPLs to any board in my tenure. And because now that I know that there is a potential legal issue, I'm erring on the side of caution and I'm not making any of those appointments. And part of the legislative review is to then uncover what is appropriate, if at all, in moving this particular category of appointment forward into the future. But yes, you have my full commitment that I will not selectively appoint. I'm actually just pausing that particular possibility for now until we have a much better view of what is appropriate there. Thank you.
All right, members, I'm now going to draw a line, and let's not deal with the right or wrong, because my understanding is that your predecessor did appoint, and we're now in a new term and you're the new broom, so we will wait for your way forward. So members, I'm closing it now for the members. Thank you very much for your indulgence on this matter. I'm also clearer in terms of where I come from and what should happen when and where, and we're still going to learn more. And I am seeing a lot of stakeholders in the House. There must be a reason. There must be a reason why we have stakeholders here. And I'm going to be fair. Stakeholders, I'm now opening up to yourselves. You are on the ground. And can I get some hands, comments? Oh, bum. Sorry, I can see all the hands and I've just been advised. Before I come to what I've been advised, Minister, that you want to come in?
Just as a process question, Chair, is it just to understand it's a public hearing that we're going into now?
No, it's not a public hearing, but because of how we've been engaging in this committee, because we learn from our stakeholders, and if there's anything we learn from our stakeholders, we grab that, and if there's any comebacks, then we look into the comebacks as well. And I've just been advised, and I'm going to ask the members to give me guidance on it. I've been requested by members. Some members have to travel, and I know some members, there's a very important and groundbreaking court case where members have an interest. It's the Jocelyn Smith judgment today, and people are interested in that as well. And I don't want to hold people here where we have vested interest as well. I just want to be fair, and I know some members must travel more than 500 kilometers after this meeting. So members, we can either go for tea or we deal with this, and I release the minister and the members, the stakeholders, members of the public and the stakeholders, and we finalize and then deal with this. So members, tea or we continue? Continue, so we're continuing. And I saw all the members have raised their hands. I'm going to start on my left. Yes, ma'am.
Thank you for this opportunity, and I think I'm possibly the last standing stakeholder with this issue. And the issue around health committees and hospital boards is not one of this the 7th year. It's been coming since the Act. And I think for us as health committees and hospital boards, I want to thank the minister that she's taking it on review. Long overdue. We've been asking this since the inception of the Act. The recommendations we've made in connection to the Act was that MPs have a constitutional obligation of oversight and not service. And that's the conflict, according to the Act, with the Constitution of this country. So I'm very happy. This report, according to every APP since the institutionalization of the Act, is skewed, according to my knowledge. Because what the department has failed to do is to present to this committee that is very new what has worked and what hasn't worked. And this is what MP Mackenzie asked this department and the previous portfolio committee, which we now cannot speak about, but it was asked in May of 2018. The reason I know it, I was here, I've dated. I went back when I received the invitation of the briefing, I went back to notes. And I think from my side, the recommendation, possibly from everyone that's not here today that wanted to be here as health committee representatives, that is not constituted, because we are not constituted. The reason why we constituted, we asked the department to use our expertise as functioning health committees for more than 20 years. Allow us to be the go-between the department and the establishment of the current committees according to the law. We've requested the law. The law didn't just happen. The department failed committees across the metro and across the province. The institutional indigenous knowledge of health committees and hospital boards is locked up in my office at the University of the Western Cape. I was the CLO in the metro for 8 years. My only purpose was to ensure hospital boards are constituted, hospital boards are functioning, hospital boards are trained, hospital boards are mentored, and that the department is held accountable. Since 2010, the department failed committees in the metro to ensuring that there's accountability. The department plan without the community voice, or they selective in who they get there. I know I won't get there. I don't have a problem. But the inside information do get to me. And sometimes even an official slip up. Oh, Damaris, possibly I wasn't supposed to tell you. The planning that the department did on the 4th of April in Lentegeur. Who of the hospital boards across the province, who of the clinic committees across the province were invited to the planning? Those are the things that has worked for the department and with the department, and even the portfolio committees in the previous administration and the current administration. And the late Uncle Polly said to the department, you will wish us away, you will hope we never existed, but we will continue to exist. And today, on the 9th of May 2025, I want to echo those same words. I'm not going anywhere unless God decides otherwise. We will come here because we can't engage with the department, because we're not constituted, we don't know what's going on. But we're on the ground, we're there. When patients call us to say, come and see, ek wil nou my brille afhaal. On Wednesday night, when the patient in F1 called, the patient called me. I asked him, sir, where do you get my number? No, somebody told me I must call you because you will come. I got out of my bed. I went to Tygerberg and I addressed the matter. That is what communities wants to see. Active involvement between health committees, hospital boards, and the Department of Health. It has worked. Since we started in 1992, we were with local government. The Department of Health at local government looked after us. In 2006, we were given over to the Provincial Department of Health, and then our problem started. In 2010, on the 25th of May, the Department of Health in this province decided that there's law, so we need to be made redundant. How do you make a community voice redundant? You cannot. And you can go back to the history of this legislature. We've been here for every briefing. We've been here for every sitting. And we will come because we are invited. And I would like to tell the minister today, Minister, let's work together. We have worked with all your predecessors. It's only when the DA took over in the province that they removed the file of the Metropolitan Health Forum out of the office of the MEC. She must go look in the archives. We there. We met with all the previous MECs, except from 2010. How will the minister really know what's going on? Is when she engaged. We're not asking for a wish list. We're not asking for miracles. All we're asking is ensure there's clear, understand, and it's the recommendations that the MP has made. Public participation, monitoring, and capacity building. That has been all in place. In my closing remark, thank you for the review of the Act, because what we recommended then were not put in the Act, and I'm glad it's not working.
Thank you for those inputs. And once again, Minister, it definitely refers to the review, and we will have another bite at that. The second hand. Are we starting on the left? Yes, sir.
Thank you. Thank you, Chairperson. Good mornings again, everyone. I want to echo what my colleague next to me has said, that we really appreciate the fact that there will be a review on the legislation. But what I want to request that when reviewing it, let it be a genuine review. Because as my colleague has said, we've walked with the department, we've walked with when the act was promulgated, and we made recommendations, but the recommendations wasn't acknowledged or even put in. That is why today the department sits with a 17% of community involvement within these facilities in the metro. 17%. It means that we don't have the voice of the community. And it is important to have the voice of the community because there's a lot of things happening in these facilities. I can sit here and talk for the whole day, the issues that are in those community. But as my colleague has said, we're not constituted and nobody wants to listen to us because they don't want to hear what is happening in these facilities. So my request would be make sure, and I haven't heard that in the review where the community is in terms of also being part of this review. And that is what my plea is. Make sure that we as the community, our voices are heard in the review, but from the outset, not somewhere along the way. It must be from the outset and it must be genuine. Thank you.
Thank you, sir.
Minister, I am Mr. Bastian. I'm from the Ravensmead community.
Please switch on your mic, sir.
It is switched on, sir.
All right.
Chairperson, it is switched on. Minister, I just want to give Minister personal experience. We had served on the health committees, like the Maris and Pastor Graham said. For many years, we enjoy it, and then when the Maris said, when the DA took over, they make a rule. Now we must send in CVs, and then the minister will pick self who will serve on the health committees. But we are still there. We are part of NPO. We are Ravensmead Health Committee. So there's 2 health committees now in Ravensmead, but we are still there. And then what basically happened? I'm just glad for the review. Well, please, Minister, that is. I don't know how can a political head make a decision like that to appoint. It means the political head can only appoint DA members to serve on the health committee or something like that. But that was our view, and then we refused to be part of that, Minister. But Minister, from my side, I really want to thank you for building the clinic. I know it is we as the health committee many years ago asked for the clinic. I know we take around 15 to 25 years. We had asked for the clinic because the Tygerberg Hospital chased us away. We can live next to Tygerberg Hospital. We cannot go there. It is evil, Minister. They chase us away. You must go to ELCs that is more than 5-6 kilometers away from us. I really want to bring it under Minister's attention because that is a hot point. But okay, I'm not there for now. I'm just happy for the review. Thank you. God bless.
I'm now on this side. Oh, sir, sorry.
Good morning, Minister. Thank you for the opportunity. It's a long overdue meeting that we should have. I met you in this year at Sub-Council 4 with Sub-Council Chair Francisco Hawker when I was not invited. And the thing is, I don't want to complain. I want to bring up also suggestions. But my first thing is, they must stop abusing their power to phone you, Minister, and email you, disrespect the health committee and the management of the day hospital, what the councils are doing. Please stop that, because there are people appointed. And then the other thing, why many of our people are suffering. I have seen it with my own personal eyes. Ambulance service, they must be improved because they stand at the day hospital, go bring people in, but don't take people back. because I am most of my time at Yalsi's Day Hospital. You can ask my boss, Mr. Lunga Makamba. That's the best manager I ever met in my whole life at the Day Hospital. The other thing about last year, the 16th of August, it was the deadline for the Health Committee to apply again. Since that time, we heard we're gonna, our expire date will be then the end of October. But up till today, some of us are still working there. We don't know what we're doing because we don't know where is the Health Committee. I asked the manager, it's no use you phone Substructure Calbrema because don't get any joy, any help there. And in future, if we're gonna be elected again, Minister, please talk with that seniors of Substructure. When the Health Committee asks for help, they mustn't keep quiet. Because our community is suffering there because of them. They abuse their power, think nothing about the community. And the safety of our people of Yalsis, which was promised by Mr. Weir. They're gonna be cameras and the wires. We're waiting now a year and a half. And you know, wasn't it for some of our community people? I'm not gonna praise myself. One of these days, I'm gonna send my wife to the minister because she asked if I am married to the day hospital. Because you see, it's my love for my community. I care about the medical staff and about our people. But please, employ people. Employ people. They are understaffed. Weekends, you must see, I count each Sunday, Saturday, till 1 o'clock, 2 o'clock the afternoon, about 90 people. That's not all. And there's only 2 doctors and 3 nurses. People phoned me last week, there was trouble. I have to leave my 3 grandkids at home. You must bring in policies also. There it comes in. Some community leaders abuse their power. They call them the escorts. The escorts is creating most of the trouble at the day hospitals. Please, I have nearly locked up one community lady last week. You know you're not allowed to take pics and videos, but they still do it. SEPs, law enforcement must do their work right. Otherwise, remove them and let community people work there. My last thing is, where's that? The training, what Minister said about for the Health Committee 2 days. I disagree 100% with you. Disagree. We have done it last time in 5 days because it's a lot of books. And the one who trained us, Mr. Regan Marcus, that man was excellent. 2 days will never fit. Please. And allow the Health Committee, if they come in again, let the help there where there is help, people are short. They don't want us to help. They bring other people in, matriculants and that. So you don't trust us. We are just there to do the dirty work. Oh no, it's not gonna work again. And the last thing, we are busy with programs. The TVs in our day hospitals, I can rather take it home because it's not being switched on. The health is busy with the TB proving project. I was also part of it at UWC. We want to bring that to ELCs. But we have a problem. Mr. Makamba told me, talk with Substructure. Substructure, I'm still waiting on an answer. Maybe they are waiting on Minister. because a lot of our community people have TB. We want to stop that. We want to help you people. We did get that knowledge. Okay, I will leave the rest for another day. Thank you.
Members of the committee and to our stakeholders, please allow me to give guidance. We're dealing with committees and we are dealing with boards. And I'm guided by procedures as the chairperson. And I've allowed it, some of the members to deal with other matters as well, late ambulances and nurses and doctors not showing up as an example. I've allowed that to happen because I did not know that that was going to come out. Now, those we will regard as comments. We will definitely take that to heart. I just like to give guidance in terms of, with the review, a lot of what has already been said, the review would cover that. And we would then also take to heart in terms of your advice in terms of how to deal and roll out the review. So a lot of these matters would then be washed during the review. So for now, I would like us to come back. And we've also taken note in terms of the amount of experience in here. The amount of experience in here, we cannot wish that away. It's not going to happen. And based on that experience, we would definitely, when it comes to our recommendations and whatever, we would take that into heart. And with some of the matters that has been raised, we would deal with that in our recommendations going forward so that we know exactly, what would be the proposals to the minister and to the department, and the minister would then respond accordingly regarding that. And I don't want to lock other people out in terms of the hands that was raised on this side. I'm now coming this way, but please don't repeat what has been said on this side because that has been noted. Can we then deal with the committees and the boards, and we now know who's not constituted, and the minister did promise in terms of giving us the list so that we will then come back to you. Yes, ma'am.
Yeah, it's the first time that I come to the provincial parliament, and I know it's not going to be the last time. I'm going to bring a streetwise perspective of being the chairperson of Lady Michaelis. Our chairpersons, we said of the different committees, we said we must start a chairperson's forum so that we can twin, for example, and I'm only using Delft. Lady Michaelis has been a white hospital before, so our experiences will be different. But how do we teach? How we tell the people, our other clinics, the challenges they have and how we can help them? And I want to start off by saying it starts with our HOD, Mrs. Van Wyk, God bless her. And I'm telling you now, I'm allergic to negativity. My second name is Prosperity. And we sat down and I took the committee and I said, there's a challenge here, sister. So as the chairperson, I'm going to start with myself. I'm going to volunteer every day with, with the holidays and that, it was crazy. But it was the best thing that even happened to me. I had a spine operation, so I was also careful. You learn so much and you begin to understand really what we can add value to the hospital. And more than anything else, Nurses Day is Monday. We've got such a fantastic function for the nurses because we know we're short staff. So we've started a WhatsApp group, volunteerism. And where do we get our volunteers from? From the patients. And they're so excited. And we induct them humbly. And we explain to them there's a process. And of course, the members of the committee, they're also worried about their badges. And I just want to say, Minister, I always look at my badge and I think on here was when my date expired. And I went to sister and I said, sister, I'm going to phone the cell and tell him my date is due. And he said, Anige, you've got 6 months extra. So in that 6 months, how can I transfer my humble skills to say, we're in the situation. Yes, it's difficult, but what can we do to help? So what do? We make sometimes sandwiches with tea. And my role that I play is with the older people and people with disability. So if I see they have a challenge with folders and I go in, and I must admit to you, was a learner who let me rather take a book. I try to be cute and remember the names and the dates. So I write it down and I say, you stand in this queue. I'm talking about the older people. You can't save the world, but you can make a difference. And those older people, you know, and I'm saying to you, we work in a different clinic. Even the staff, even we just peel an orange for them because we know they're busy. It's tea time. So what do we do to create an environment where people want to be there? I mean, we have sometimes 400, 450 people a day. It's crazy. It is crazy, but you can make the environment. You try to make the environment better. I can't compare Lady Michaelis with Delph or with Gulet or Kailicha. We're talking two languages. And that is my reason for saying, can we start a chairperson where we can share, where we can say, you know what, this is what we do, and start small and say, how can we impact? And this review, yes. And Mr. Van Wyk, I agree with your comment in saying that there's space for the health committee to operate in a professional way. Today we heard the MPLs and members of parliament here saying, but you've got to listen to the people in the clinic also, because we streetwise, we experience it. I couldn't understand why the taxis were standing outside. I said, we've got new clients here. How do you mean nothing? I went to them, I asked, so why? We dropped the children at the school, so we make this our base. It's another 50 people added. The answer, so those are the things, those are real things. And Lady Michaelis, of course, is a nice clinic. So you find our client base is from big areas, all different areas. And you can never handle two patients the same, but you've got to be tactful for them. Not always that you can use tact, but I'm just saying, communicate with the committees. What we are saying here, and I appreciate the comments by the members of Parliament also on video. We also want to learn. I'm 75. How long am I going to be at the clinic? But I know I can transfer my skills. I teach them how to make lekker sandwiches, lekker. And I go to companies and I say, can you give us 5 bread? Can you give us a kilo butter? So I'm just saying, this, what you did today is, wow, I can't tell you enough. It's priceless.
Thank
you
you, ma'am.
understand the real streetwise challenges, and it's real. We can't wish it away. So thank you, Minister.
Thank you.
Sometimes I have verbal diarrhea, but okay.
You've just reminded me. Going forward, I think this is also a new experience in this new year in terms of how we're going to deal with matters in this committee, and also members get limited time to speak. We're going to do the same to the stakeholders as well. Members get, but we'll tell you, you've got 1 minute or you've got 2 minutes, etc. But going forward, so that we know when we're going to deal with, engage after the review, that we have everything to the book. Yes, sir.
Chair, thank you very much, and MEC, thank you very much, and to the members, thank you very much for giving us this opportunity. Now, it's not to sort of like steamroll you guys, but I think maybe a little bit of networking might be good for all the members. The other thing I'm going to say is there's a time for politicking, and medicine and medical responsibility is apolitical. So if you're going to be, okay, as a responsibility as a councillor, to be on a health committee, that's fine. But that's because of local government functioning. In the same context, how is it that a hospital facility board doesn't have the same requirement? You know, there's gaps in all the legislation, and all of Ms. Kivitz will probably back me up on this. Reading the legislation as I have, all I can say is that this was done 5 minutes before it was presented to province, because it's chaotic as far as legislation is concerned. There's no continuity in a lot of things. And also, I mean, how is it, I can see in concept and in context that a hospital facility board might have oversight over its local clinic. But I can tell you one thing, and I represent or have represented New Somerset Hospital Facility Board, of which the MEC is also familiar, having served 1 or 2 terms at New Somerset. The biggest problem is you look at somebody like the treasurer, who, if you look at the Financial Act portion, the treasurer of the facility board has oversight and has the responsibility for whatever fundraising is done by a health committee. The response was, to hell with that. I'm already a volunteer, and why must I be involved with a committee when I'm already dealing with a hospital? Which I totally understand. There's also something else that happens, and I think there's an elephant in the room which nobody's spoken about yet. And I'm very conscious about budgets. But just as much as I'm a volunteer, it costs me data. As an example, why is there no stipend made available? The closest thing we get is something called a transport remuneration. 24 Rand is what I get, but I've given up trying to claim it, because if you see the form, 24 Rand from Woodstock to District 6 Clinic when I have my monthly committee meetings. I mean, what a slap in the face. You know, data costs more than that. If we're talking that, I need to talk to various people. I need to communicate. That stipend means so much, but nobody here so far has mentioned it. And it needs to be looked at. Eastern Cape have a stipend, and so does Gauteng. I'm fully aware that there are deficits in budgets and things like that, but there are realities. And part of the parcel, I can tell you, if I have not spoken to 20 people recruiting for the new health committee term, I've had 6 responses, because there is a problem. One, we must have youth content. Students haven't got the time unless they are rewarded. Number one. Okay, so you're going to sort of go through the dynamics. But just recently, and I don't know if this has sort of been motivated by various things, but there's the People's Health movement. And literally all the chairs have come together at UCT in the past 3 months. And we're discussing this because what we need to do is actually constructively review the legislation and come up with suggestions and try and make this thing work, because we know it's not working. Just very quickly.
So you'll submit that to be considered for the review?
Yeah. There's, as I say, if I could make members available, or sorry, make members aware, and to come and familiarize themselves with us, as in members of health committees close to them. When I sort of say an underground movement, there's moves afoot to actually approach both the MEC to start with, with constructive suggestions. But also the other crucial thing is that we're on the ground as frustrated as anything. I can tell you from the years that I've been involved with this, which is probably since about 2012. Our facilities, and I'm responsible for 7 of them, just here in the CBD, because we can't get individual, so we have a cluster. The stonewalling that goes on between the facilities, telling us what we can't do, and yet they don't understand the full thing of the oversight. They're more sort of distrusting of us as community members coming in to actually be constructive about things. As far as the regional office is concerned, yeah, there's a lot of stonewalling. When it comes to human resources, the HR department, do you know how long it took to actually get for Auntie Gaia to get her ID or my ID? I was the one who motivated that kind of stuff because I said, where is it? I can go on and on and on. And unfortunately, this is the reality of it. I'm going to afford everybody else some time, but quite honestly, please speak to us. I have a hell of a lot of stuff here.
All right. Folks, with all due respect, even this committee has got time limits. We've got times to get out of here so that another committee can come in. We really have noted the comments, and I promise we will have a second bite when it comes to dealing with the submissions to the review and even our inputs to the suggestions of the review. So folks, please, may I ask that anything else can be submitted when we do those submissions, because we still have some work to do as the committee before our time expires for the next committee to take the chambers. I don't want to be, yes. So, no. I mean, there's another committee that must come in now after this. So we still need to conclude, and thank you for really the inputs that you folks have made. I'm now just going to give over to the minister to do some closing remarks, and so that we need to wrap up before I get fined for stealing other people's time. Minister.
Thank you very much, Chair, and to the members of the Standing Committee for the engagement, and thank you to the members of the public for the comments. We've noted them, some good ideas in the mix there. The survey will be going out to all the boards and clinic committees shortly, so I kindly ask that there's a good level of participation. This is the first round. There will be many more engagements. Also, just to mention that when I go around to the various facilities as part of my listening and learning tours, I always invite the boards or clinic committees to join us, because that's a very important voice for me to hear and to be able to engage with the communities. With that, we will then provide the information as requested by the committee. Thank you very much.
Thank you, Minister, and thank you to our stakeholders. You may go and enjoy some tea and coffee, whilst we as the committee would then deliberate and make the recommendations as per your inputs. Thank you very much. So, okay, if you will pay me.
Time to invite.
Kia koto kona msasi. Kosima. Yeah. Tea, coffee, guys. Thank you. Yeah, we'll come. Yeah. Thank you, Member Van Vogel. All right, members, thank you very much for your indulgence. I know it took a bit too long and there were some turns and twists. Can we then now deal with the recommendations, members? I know we've made I don't know, Nomonde, if you have synchronized some of the recommendations yet. Member Walters?
Chair, I've clearly seen it already in the meeting, but I would suggest three recommendations. One recommendation is that the committee gets feedback in terms of how they attract talent and representative and qualified, I don't want to use the word qualified, but representative and fit for purpose talent from the community to participate in hospital boards. So we get a diversity of talent and representation there to make the system work. That's my one recommendation. My second recommendation is that the committee gets feedback as to how prospective hospital board members are provided with support and capacity building. And my third recommendation is that the committee gets feedback as to how the efficiency and effectiveness of hospital boards are monitored on an ongoing basis. I hope that is clear.
That is clear, member. It's noted as such. We will just polish it myself on the Monday when it comes to that. Member Stevens?
Thank you, Chair. I agree with Member Walters. I also wanted to say here that it is important that the department must ensure that boards and committees are functioning as intended and not merely symbolic. And also their performance must be evaluated and reporting mechanism in place to assure that the effectiveness and the impact. Please, Chair.
Thank you, member. That's noted. Member Jacobs?
Yeah, thank you, Mr. Chair. Mr. Chair, yeah, I just want to say, you know, when you hear us, when we always speak and when we talk about stuff, did you hear now from the stakeholders? That is exactly us, Chair. When we speak to you guys, what I'm saying is, no, remember we have broken something that was working. When you're listening to those stakeholders that was there, they have information in terms of how things was working. I think what we need to do, Chair, is we need to have more meetings with these people so that we can get ideas also from them. And when recommendations is made or when we put stuff forward, then we know that let's bring something forward that was already working. Remember what these people are saying, things has worked for them until it may rather just keep quiet there. But I'm saying, let us also engage with these people and really formulate, you know, what is really going to work and what was working already. Thank you.
That's noted, member. Thank you. Member van Wyk?
Chair, I would like to second the proposals by members Walters and Stevens.
All right. Member Walters, is there the legacy hand?
No, Chair, it's just I'm just taking a stab at wording what Member Jacobs made me think of. I would suggest that we also add that a part of the feedback that we should receive is an assessment of what has worked and what has not worked. I think it would help us prepare us for a review going forward as well. But yeah, maybe just to word it, to have an assessment of what has worked, what has not worked, and what the department's proposals are in terms of what will work, and that we get a report or an assessment in that regard. I think it will assist us to both distinguish between the anecdotal and the factual, to assess quality versus quantity. And I think ultimately we can all agree that we want to have a system that, along with community participation, continuously improve. So yeah, that's just a stab at putting that into a resolution that we can 5 years from now know exactly what we proposed. Thanks.
Thank you, member. I think that is something that, at another meeting, when we look at our activity programs and whatever, maybe we can slot something of that nature, where we just engage, with the stakeholders, and it would make our meetings easier going forward. Any other recommendations? Going once, twice, Member van Wyk?
Other than seconding Member Walters' latest comments.
All right, Member Walters, that is also noted as a recommendation. Can we then deal with the minutes? Minutes were circulated, minutes of the 28th of March, 2025.
I propose the 25th of March's minutes for approval.
Proposed by Member van Wyk. Any seconder? Seconded by Member Van Vughel. Can we then deal with the committee annual activity report? Are we guys happy with the activity report? Can we?
Yes, I think we agree with that.
All right, we're happy with the activity report. Can we then deal with the last one, 12.3, the draft committee program? Shall we treat Member van Wyk?
Yes, I think we can agree with that, but I think, as would appear with the budget, that national budget that's due to be tabled later this month, and the potential knock-on effects on the workings of Parliament here with us. I think we recognise that these programs may well change in the short term.
So, member, are you saying that we adopt the report, but we need to be flexible because with the budget processes there will be changes coming? Member van Manen?
I think we have to accept that it's subject to change given the bigger environment that we're operating in. Thanks.
All right. I see Member Van Vughel nodding, and we accept subject to change. Members, thank you very much. This has been our longest meeting as far as I can remember, but we're definitely going to take the comments and experiences learned out of today's meeting going forward. Thank you very much. The meeting is adjourned.
Thank you, Chair. Thank you, members.
Thank you, guys. Is this not the longest?
Chair.
6 o'clock at night. Yes, sir.
Chair, can you hear me?